There are differences in applications of new treatments and advanced therapies to different racial and ethnic groups. I'm a nephrologist, and so one of the ones that comes immediately to mind is thinking about one of the newer therapies for diabetic kidney disease, SGLT2 inhibitors. There are good data that show that Black patients in particular are less likely to be prescribed SGLT2 inhibitors compared to white patients. Now, there are probably myriad barriers to Black patients being prescribed some of these newer and advanced therapies. One may be insurance status. We've alluded to some of the barriers in terms of, institutional barriers and social barriers that may affect insurance status. But there may be other factors that are playing into this disparity in application of these new therapies. I think that our own bias about what kinds of therapies a patient may or may not be able to adhere to may creep in and affect our decision making. And so I think that we have to be careful to make sure that bias isn't creeping in and affecting our judgment, and thinking that a patient who may have limited education may not be able to adhere to a complex treatment regimen, or may be less likely to take a medication that may be more expensive, or may have a more complex schedule. I think that we have to make sure that as clinicians, that first we recognize that every one of us has biases, and if we're not aware of them, it's harder to overcome them. I'll give another example. There was a nice paper looking at patients with heart failure from a major teaching hospital presenting with the same symptom complex. Black patients were much more likely to be admitted to a general medical service compared to white patients who were more likely to be admitted, relative to Black patients, to a specialized cardiology service. Why is that important? It's important because if one has heart failure and is under the care of a cardiologist, that patient may be offered more of the tailored and advanced therapies than if one is under the care of a generalist. So again, thinking proactively about how bias may creep into our decision making may help us to overcome it.